All right. Hello, everyone. Good afternoon. I'm Malaya, trainer with ARC Safe Del Norte, and I just want to welcome you all to the presentation this afternoon. We'll be going through Wellness Through Treatment and Culture with Jeff Guido and Robbie Lara. Um, Again, thank you for joining us today. We appreciate having you all here. We are on week 4 of the Wellness and Recovery series. We're getting close to the end, and we appreciate all those who stuck through it and joined us for this past month. And we encourage you to finish up with us and check out some of the amazing workshops and presentations we're going to be having for the next 2 weeks. So again, thank you all for joining us today. If you are on Zoom, please keep yourself muted and your video off. If you have any questions, you're totally welcome to leave them in the chat during the presentation, and we'll try and get to them when we open it up for questions. We are live on Facebook, so for anyone watching on Facebook, there is about a 45-second delay. So just keep that in mind. If you have any questions, you're welcome to leave them in the chat on Facebook Live also. But since there is a delay, it may take us a minute to get to them. But you're totally welcome to leave questions and comments, of course, respectfully. So again, just thank you all for joining. And I want to welcome our 2 presenters today. If you want to introduce yourselves. Jeff, would you like to go first?
Sure. Just want to say thank you, everybody, for joining us today. Thank you, everybody, for putting on this event and giving us this forum to be able to have these discussions. It's really appreciated. My name is Jeff Guido, and I am a Yurok Tribal member and also Tolowa descent. I'm currently the substance use disorder supervisor for United Indian Health Services, and just look forward to having a conversation today and making sure everybody knows what kind of services are available to those that qualify for United Indian Health Services. Thank you.
Hi, my name is Robbie Lara. I'm a substance abuse counselor at the United Indian Health Services. I started this year in 2019 in September. I'm still a student in addiction studies at College of the Redwoods, but I am a registered drug and alcohol and drug technician. Thank you.
Thank you both for joining us. We really appreciate having you today. I know I'm really excited for this presentation. Being, a Native youth in this area, it's something that means a lot to me. So I appreciate you both being here to speak on it today. Before we get started, of course, we do want to do a little bit of housekeeping for everyone watching and joining us today. We'll go over a few group agreements that we always have at the beginning of our presentations. Remember, respect and kindness are key. If you're not being respectful and it becomes a persistent issue, you will be removed. Please show tolerance and sensitivities for differences. Participants in the group come from different cultural, racial, gender, and sexually oriented backgrounds, so please be aware and sensitive to judgmental comments. Use positive language and definitely stay away from using racial, homophobic, or degrading remarks. This is a safe space and it is free of judgment, and it's totally all right to disagree with someone else's point of view. However, we don't put each other down for it. This is a space where participants should feel comfortable to be themselves, share their thoughts and any ideas without any worry of punishment or judgment. If for those who may be sharing stories today, if the participants or those watching in the chat are sharing personal information, you should try and leave out specific names out of your stories, because using names can often aid in the spread of rumors and detracts from the point of the information trying to be communicated. So out of respect for others, we ask, be careful using people's names in stories. And of course, if you need clarification or don't understand something being talked about in the presentation today, don't be afraid to ask questions. Again, questions are open in the Facebook Live and the Zoom. So if you have any questions, feel free to leave them in the chat and we'll try and get to them, and our presenters will try and get to them when they open it up for questions. So feel free to ask for clarification. And as always, we want to make sure people are aware that some of the content we'll be talking about in these presentations can sometimes bring up some emotions, feelings, concerns that may be triggering, or may bring up some feelings that make you feel like you might need to reach out to somebody. So if you are feeling that way, please reach out to somebody. We encourage it. We've provided some numbers such as the mental health for Del Norte hotline here, as well as some 24-hour crisis services that are always available. Again, sometimes heavy conversations can bring up a lot of emotions that we may need to process, and these numbers can sometimes be a great help to people who are feeling that way. So we encourage reaching out. As far as informed consent and privacy, each person's participation in this presentation is voluntary, so please respect the privacy of others and do not share personal information with anyone else. This training is being recorded and it is live on social media, so if you are participating via Zoom, please turn your video camera off and stay muted. And of course, we always wish to acknowledge that we are meeting virtually across the lands of many Indigenous people. Personally, I am coming from Tolowa-They, so I want to honor that and that I am on, recognize that I am on that land today. Some other areas that we want to recognize that people may be meeting from are the Tolowa-They, Yurok Tribe, Hupa, Wiat, and many rancherias such as Elk Valley, Resagini, Big Lagoon, Trinidad, Blue Lake, Table Bluff, and Bronerville. If you aren't sure where you're meeting from, it's okay to do the research and find out, and just acknowledge where you're at. It's always important to do that when you are meeting with people. We honor the Indigenous peoples who lived together and cared for this land and each other since time immemorial. We honor with gratitude the land itself and the people who have been stewards of this land for generations. We know the effects of colonization have impacted Indigenous people disproportionately, and we hope that through this series we can learn together to help heal and work towards a healthy future. So again, recognize where you're at today. If you are meeting with us, we appreciate you making that recognition towards the land. For everyone watching today, remember that you are welcome to leave questions in the chat on Facebook Live. We have people monitoring as well as in the Zoom, and we'll try and get to them when it opens up for questions. And yeah, I just want to hand it back to our wonderful presenters and thank them for being here again today.
Okay, so Robbie brought this to me, this event, and we felt it was really important in the times we live in today with COVID and all the changes that are going on, that we can bring to you what's available still for substance use disorder treatment. And so that's what we came here today to do, to kind of talk to you guys about what kind of treatment options are available, what our process currently is for those seeking treatment. We also want to talk a little bit about our vision of treatment and our style of treatment. It might be a little different than maybe county, AOD, or other programs. Being a Native organization, we get to we get to delve into things that are specific to Native Americans and recovery. So just really grateful that once again that we're able to be here to do those things today. So I'll start with some of the things that are available and what we have in our program. And then we'll kind of talk a little more about our vision for treatment and our styles of treatment and things like that. So currently in Humboldt County, we have our substance abuse program at Potawot and Arcata. We have 3 counselors available. In Del Norte, our main office for our substance abuse program is based out of Elk Valley office. But we do also have a counselor that goes to Smith River on Tuesdays. And we also have a counselor available in Klamath on Fridays. And so some of the things that are going on with COVID right now, we can only do our group sessions through Zoom because we haven't yet found a way to effectively social distance and be safe with COVID going on. And so we offer our groups through Zoom. And if you're anything like me, trying to figure out how Zoom operates sometimes can be difficult when you're a little older, trying to learn new things. And so we do have people that are available to be able to help navigate through Zoom and do some test runs and make sure that everybody's capable of using Zoom and understanding how it operates. For those that are comfortable and they're not classified as high risk for contracting COVID, we are doing some individual sessions. We do have some precautions that we're taking when you enter a facility at the front door. They're doing temperature checks. We're doing quick screening questions, look for any symptoms that people might be having. And once you enter, we are masking. We're trying to do as much social distancing as possible. And of course, hand sanitizing. In our little tiny department, I believe we have about 5 hand sanitizer stations. So it's important to us that we stay safe, but it's also important that people that are seeking treatment in this time, that's a really stressful time, also have that access. And so, but we also respect those that, maybe are taking the shelter in place just as a choice to, as precautions to be safe. And so we can even do our individual sessions through Zoom for those that are more comfortable for doing it from home. And the one thing we can't do over Zoom yet is our drug screening. To collect random UAs, we haven't quite figured out a way to do that over Zoom yet. So you do have to come in person if you're doing your random UA screenings for drugs or alcohol. But we take every precaution possible to make sure that everybody's safe and that we're following the guidelines that are set. So our program, we take people that are self-referred, which means if you're just choosing to seek help, you can walk in or call one of our offices and set up an appointment. But we also take referrals from places like CWS, probation, parole, TANF, drug court, and other outside agencies. We work closely with them when there's requirements that need to be met and try to get our community to meet the goals that they need to meet to fulfill any requirements that they have for any outside agencies. So the process is you'll start with an assessment. You'll meet with one of the counselors and you'll go through an assessment to determine your level of care. And so basically what we're looking for is your level of addiction so we can set a treatment plan that's in line with the level of addiction. Our program at United Indian Health Service is an outpatient program. So that means you show up for your Zoom groups and your individuals, but you're doing your recovery from home, basically. We do have the ability, if somebody's level of care is higher than outpatient, to be able to make referrals to places like detox when it's needed, inpatient treatment, also known as residential treatment, where individuals will live at a treatment facility and do either 30, 60, or 90 days in a residential treatment. We try to utilize IHS funded facilities first, which are in San Francisco and towards the Central Valley. We do utilize a couple local residential treatments, Waterfront and HRC, for those that qualify. Those facilities we try to reserve for those with very severe addictions that have a lot of limitations or barriers to either whether it's the wait time getting into one of the inpatient facilities or maybe they have some things going on here that they have to attend to. There is funding for local facilities for those that qualify. And when we don't have shelter in place and things are going about as normal, we do have other groups that we're currently trying to figure out how to work through Zoom. We do have a lot of cultural groups that incorporate different principles and values and different cultural activities. We usually have a beading group, horticulture groups. We take people on a lot of cultural outings to engage in cultural activities, things that maybe they wouldn't engage in on their own. We have a sweat lodge here at Potawot on site. Obviously, we're not able to do that right now. And we also send people into the jails and be able to meet with our clients in jails and try to get the ball rolling for recovery. And I know in Del Norte, we had started going back into juvenile halls, and we're also available down here in Humboldt County to go into juvenile hall if we need to. Let's see. Transportation. In Del Norte County, we have the ability to offer bus passes to people that need to get to their appointments or whatever they need to do in their program. Down here in Humboldt County, we also have bus passes, but we have a behavioral health transportation van. Because of the social distancing rules, it's kind of limited right now. We have to limit how many people we can pack into a van. So it's available, it is limited, but right now there's openings for the van ride. So transportation, we do assist with that. We do see youth. Our agency is actually on an aftercare committee for Desert Sage, the IHS youth residential facility, and trying to work and develop some good aftercare strategies. Right now in our outpatient program, what we have are individual sessions and the ability to be able to do some drug and alcohol screening and hopefully create some accountability for our youth. We try to have some youth groups going. Everything right now has kind of got us playing catch up, so we don't have youth groups going right now, but we do provide individual sessions. And Dr. Katie Castle was on this morning for United Indian Health Services, and she talked a little bit about our medicated assisted treatment program. So those of you that are interested in hearing a little more about the medical side of what I'm about to talk about, please look back at the presentation that was done this morning by Katie Castle, and she provides a lot of information from the medical field side of our program. And so we do offer a medically assisted treatment in conjunction with our medical department. I'm not sure if everybody's heard about what that is, but with our opioid pandemic going on, it's an option to help people that are suffering from opioid addictions. And it in and of itself isn't really a treatment. What it does is it helps relieve the side effects of withdrawal. When somebody's in withdrawal from opioids, it's like there's no way they're going to ever focus on the treatment aspect. And so this medication working in conjunction with some type of a treatment program, it just really allows a person to be able to sit still, to be able to do the work that they need to do. And we're working really hard to get the program where we want it to be, because there's a lot of proof that shows people that are taking buprenorphine or some other type of medication to assist in treatment, it's the treatment aspect where they're really going to get the work. And so where they're really going to gain well-briety and some balance in their life. And so I think that covers about everything that we have right now. And if I didn't answer it, I look forward to questions from you guys, and we will answer them as soon as they're relayed to us. But I wanted Robbie to talk a little bit now about just kind of our thoughts and our visions, and kind of hear a little bit about how we think of recovery. And so, Robbie.
Do you want to wait for questions from the services now, or should we just go ahead and go on into this?
Are there any questions that are pertaining to what we just talked about, or do we know?
I'm not seeing any questions yet.
So what I really liked about coming to work here at United Indian Health Services is one of the first things that I recognized is the layout of our building. And our building is, it's a circle. And so in the middle of that circle is like a garden space. And I look in there and there's two things. There's water and there's a garden space, or maybe there's medicine growing in there. And so I thought that really speaks a lot to what the philosophy of wellness in this unit. And it's a cultural value, I think, that we include all of these things in wellness, which is we have medical, we have mental health, we have substance abuse, we have dental, we have vision, we have nutrition, and we have cultural things too. Like Jeff mentioned, we have the sweat, and we take people to dances and we do beading and things like that. So I really like this as truly a holistic approach to wellness. And so right now it's becoming kind of more common to do an integrated style of wellness. And I think, we really have that right here. So it doesn't matter what door you come in. If you're seeking help in nutrition, it's related to all of these other things, and we're available for you. If you come in for medical, and we know now that through ACEs scores that your illnesses can be related to trauma, and we're here for you for that. And if you came here and for substance abuse, and we could also look into your wellness in other areas, and we like to recommend that you get physicals and dental and even education. We're even, providing for mental health here at the same time. And so if you're qualified for services here, you're really fortunate in that you have this kind of a rounded services available to you in the same building. People who are not qualified these services, they're going to one place and they're getting treatment for one thing. And sometimes they're not able to get that treatment, and that's not a mental health issue, that's a substance abuse issue. So then they have to go into another direction. So I really like that we have all of that here. I have a story to share, and it's called The Three Sisters. And so this story is about these three sisters that were walking along the river. I call it walking meditation. And because sometimes we walk by water and we can get the songs from that water. We believe that, a song has its own spirit. And so these sisters were walking along the river there, and one of them noticed that something was floating in the river. It was floating down the river. And she looked, and here it was a baby. And then pretty soon she noticed that there were more things floating down. So there were more little babies floating down in the river, and they were just shocked. They didn't know what to do. The first sister, she just just ran and leaped into the water, and she swam out there and she grabbed a baby and she brought it to the shore. And she jumped in again to try to get another one, and her sister was just standing there shocked, and she said, help, help, they need your help. And so the sister noticed, well, she's never going to get all of those babies out like that. She tried a different approach, and so she tried to teach those babies how to swim, just blowing in their face to make them hold their breath and teaching them how to paddle. Some she flipped on their backs to see if they could float. And she looks at the third sister and she says, come on, jump in and help us. These babies, they need your help. And the third sister watched her sisters working so desperately, and she said, but there's still babies getting by them. They're never gonna, I better run up the river and see what's going on up there. And so she took off running, and her sister says, hey, where are you going? And so she went up there to find out how are these babies getting into the water? And so this story, you know, I first heard in working with the Red Road, and that's a recovery program. And I really relate that to what is going on. A lot is in our cultures, but sometimes it's in our personal life. And so I really like that story. Some of the things that are up there, you know, when you're looking at this mind, body, and spirit model that we use in the medicine world, that in Western medicine now they're using, it's called a biopsychosocial model. And so we want to look at those three areas and find out what is going on. And so in the area of the biological, what some of the things that are going on there is pain. So with opioid addiction, pain is the big thing. And it doesn't matter if that pain is in physical or emotional, because the body the brain registers it the same way. And the opioid actually, it numbs the pain for both. And so there's also illness. This can be related to trauma. Trauma can manifest itself in illness. That's why we have ACEs. That's why we have trauma-informed care now. And even if you were at some point, you had done prescription medication for an injury or maybe a surgery or something, that you could become up to 19 times more likely to use heroin, to start using heroin. And so, you know, all of these things could be why. All of these things could be what is there at the headwaters. And that's just in the physical side. But then when you look at the psychological or the mental side, a lot of low vibration feelings like fear and shame can exist in somebody. Just a negative thought system. A lot of people have conditioned themselves to think in a negative pattern. And, you know, pain in negativity, it attracts itself. So it attracts like vibration. And so people who tend to see things in the negative way kind of pull that towards them. So that will perpetuate itself into beliefs such as I'm not enough, I'm not lovable, I'll always be alone, nobody likes me. And so these are, you know, it's incredible emotional pain. And then in the social aspect, this is really important. It's one of the things that is kind of credited to most addictions is lacking meaningful relationships. And so this means that a person could be sort of isolated, like they don't really participate in the culture or with their community. And maybe because of their use, they had been expelled from their families, and maybe some of their friends even didn't want to be around them anymore. So they're really isolated, and sometimes the only groups that they belong in or that they feel that they belong in is with other people that are using. but and that's kind of the one thing that is really strong is the peer pressure to use. So my friends are doing it, so maybe I'll try it. And so we have all of that, and healing, coming here, taking that first step, asking for help, and getting here. These are some of the things that we offer with our different types of treatment. We use DBT, we have mindfulness here that we use in substance abuse. And we have the Red Road programs. We have groups, and the groups are really to try to get our community members involved with other people that have similar situation and that they can relate to. And also it works that they sort of kind of hold each other accountable a little bit. But the physical side of this treatment, like Jeff was saying, is the medicine really just treats the symptoms of your withdrawal. And withdrawal is part of the reason that these opioid addiction, it just perpetuates the addiction because of that pain, of that withdrawal. Some of those withdrawal symptoms are like a person will feel like they have the flu. So and they get diarrhea. So their bones ache, their muscles ache, their whole body aches. And they could get, they could be shivering, have chills. It produces a lot of panic feelings of anxiety. And so with all of that, the one thing that their mind and body is saying is get some more of that so that, you cannot focus on anything else. You cannot focus on trying to deal with the mental issues or your other biological issues going on. You're just focused on getting that next fix. So the medicine in our MAP program, it gives our community members, it just presses the pause button on that for a minute. And then when you have that pause button and you have a little bit of relief, then, we can start doing some work.
Robbie, if I could just add real quick, I really liked that story when Robbie shared it. There's no doubt that buprenorphine and medically assisted treatment programs are definitely lifesavers. They definitely reduce overdoses. They definitely reduce risks of infections. They reduce maybe negative behaviors and obtaining drugs, and that's an amazing thing, But then when I heard Robbie's story, I was thinking about our side of the treatment. We have to always remember there's two sides. There's the medical part to assist the treatment. And so when people can get to that place of not putting ourselves in a position to overdose or to get through those horrible feelings of withdrawal, when that's all people could focus on, it's so important to be like that third sister and go up to the headwaters and figure out why are these babies ending up in the river in the first place. And so I just really want to say thank you, Robbie, for sharing that. And kind of describes our philosophies here. Too much we hear people stigmatizing people in addiction and thinking that it's just a choice. People are choosing to live this type of existence, and it's just not true. We need to ask more questions of what is causing this, what's leading to it. And so I thought that really summed up how everybody here feels. No judgment, no criticizing. It's just we want to figure out what is at the top of that headwaters and try to ask what's going on. So appreciate that, Robbie.
Yeah. I think that's something that needs to be in a conversation, with the greater community, is the about stigma. And so I learned a lot in working with people here, our community members here, and their recovery and I learned that they're compassionate people, that they make the best of their situations. Some of them, their use began in the womb, and then when they came out, maybe their nurturers were not available for them. So maybe they were sent to live with foster care or maybe a grandparent. And so, it's just when people start out like this, it's everything, it seems like it's all against them, and how that are they expected to turn out? And it's really amazing when you find out how they do turn out. Aside from addiction, which is just they're trying to treat their the symptoms that we talked about of maybe not fitting in, of maybe feeling abandoned, or a lot of other things that could be why. But what I learned about them is that they're intelligent, that they're resilient, and so I just would really like to speak about how to address that stigma. I know that there is a lot of programs that are trying to address that. And I do have another story for that, but I'll wait until we maybe want to get some questions or any more comments.
Yeah, so we do have a couple of questions in the chat. Going off of your story, we had a question, I'm sorry, where did it go? Oh, yes. Thank you for this story, Robbie. What does each of those sisters represent?
This story, like I said, I first heard that story in the Red Road. And then when I tried to find details like that, I found that a lot of people were using that story. And so I think it's one of those stories that just sort of applies to the situation that you're using it in. And that's true for the next story that I have too. But in this story, I have thought about what are these sisters representing. I think the first sister that jumps in and tries to save somebody, for me, that's sort of like the medical part of the treatment, which is it's saving you from your withdrawal symptoms. It's giving you a break, because if you don't have that, you're really stuck. You're really stuck into looking, you think you may die. It's that severe. And so that helps, but it's temporary. The tendency could be for that baby to jump back in if they're not really treating the other aspects of the well-briety model, which is, you're out of balance, and in order, it should be in a really good balance. So looking at those other aspects, mental and physical. The second sister, she goes in and she tries to teach them to swim. I feel like that's our job as counselors. We're trying to teach them coping skills, we're trying to teach them scenarios and give them places to to come to socialize. And the first sister that runs up the river, I think that's the community member themselves. It's their own treatment. That's their own journey. They're the ones that have to go up there and see what is going on at the core of me. What do I need to take care of? Where am I out of balance? And then make a commitment to rebalance. So there's always talking about something, but the commitment to do it is what is the work. And so this may include jumping back in the water a couple of times. Somebody has to scoop you out again. Somebody has to show you how to swim again. It's a process. Thank you.
Thank you so much for that. Amazing stories, by the way. We do have a few more questions. Both of you are free to answer them, either one or the other, or if you both want to answer it. Some general questions. One is, how does a person qualify for services at UIHS?
Well, for United Indian Health Services, you need to be able to have proof that you are a member of a federally recognized tribe or rancheria. But also, I believe there's you can be a descendant. So maybe you have a roll number or some proof that you are connected to some type of federally recognized tribe or rancheria, and maybe your kid no longer qualifies because unfortunately there's a lot of things of a blood quantum and a lot of tribal designs these days, and so maybe a child doesn't necessarily have their own tribal ID. They can go off of their parents. I'm not too comfortable explaining exactly who, but we do have a department called Member Services here at the clinic. Our main line that will get you to whoever you need to is 825-5000. And so if you ask for Member Services and you're not sure if you qualify, they can run down the whole list of who qualifies. But that's kind of the gist of it. So basically, if you are a member of a federally recognized tribe or rancheria, or maybe your parents are and you have that proof of their enrollment plus a birth certificate, there's specific things you would need in that area. But definitely ask Member Services for sure. That's once they get back to our department, we already know that they qualify. So it's not quite my expertise, but hopefully that helped a little bit.
Yeah, and we had another question that is pretty similar, like, are these services provided to Native people as long as they have a roll number? But it seems like you answered that. There are some resources.
We're made up of 9 of the local tribes, the base of our program, but we provide services to anybody from any tribe.
Awesome. And another question kind of going into that, if people don't have insurance, will they still be able to get services?
If they qualify as as being able to come to the clinic here, yeah. They always encourage people to get Medi-Cal when they come in. But if you qualify for services here, then you don't have to have insurance.
Wonderful. And the last question we have for now is there a timetable when people enroll in outpatient?
Not quite sure. I'm going to take a stab at a guess at what they're asking. I'm guessing maybe they're asking like how long are people in outpatient, maybe is what's being asked. And that all depends on their assessment for their level of addiction. We have people that their level of addiction is fairly mild, and they may just do individual sessions a week with a counselor, to outpatient, which might be a couple of groups a week. And when we're fully running, we have intensive outpatient, which the state defines as 9 hours of service a week. And so that would be 4 2-hour groups and one individual session a week. And it typically lasts about 90 days if there's no relapses, if they're showing up. If there are relapses, then it kind of just shows that we need probably at least a few more weeks or so to kind of go over what happened and make sure that we explore what happened. But typically it's about 90 days to complete our program.
Awesome, thank you. Robbie, is there anything you would like to add to any of those questions?
No.
All right. Thank you. We do have a comment asking or saying, I have had many friends that have succeeded in recovery at UIHS, and I would just like to thank the providers and UIHS for their continued dedication to the community. Keep up the good work. You are valued and appreciated. And we have a lot of gratitude in all the comments. Yeah, so those are our questions for now. And again, for those watching, we want to encourage you to ask questions that we will get back to at the end of the presentation. Oh, and it looks like we have one more question. This is for both presenters. On a personal note, can you tell us why you chose to be substance use disorder counselors and what inspires you both? How do you take care of yourselves to remain balanced?
Boy, this young lady's coming up with some good questions. I'll go first if you want, Robbie. I chose to be a substance abuse counselor because I've been through a lot of my own hardships that came about at poor choices that I've made in my life. And for me, it's kind of a way to redeem those poor choices and the consequences that came with it. It gives meaning to it. If I can help somebody learn from my experience, or maybe give them some guidance on getting back on track and living a healthy life and well-briety, then for me, it kind of means that I didn't just waste those years where I was out making poor choices and having poor consequences. What inspires me is just watching somebody's comment about knowing a lot of people that have succeeded. Every time I get to see somebody change their life, whether they're here with a CWS case and they get their kids back, and watching them move into their own apartment, or watching those that have been coming for a long time and getting themselves a job and getting them a place to stay, those that are getting back into their cultural ceremonies, that stuff inspires me. And the other question was self-care to remain in balance. I probably work a little too much and probably take a little too much home with me. So basically, I'm really grateful that I have a great support system, beginning with my wife and people that I work with, just being able to talk about anything and talk about how I'm feeling, being able to express myself today and acknowledge my emotions and sit with the difficult ones and know that they're going to pass. I mean, my self-care is just being able to talk and express myself first and foremost. So I think that was all of the questions there. Robbie?
Okay. What inspired me to choose to be a substance abuse counselor? Well, one thing inspired me to go to school to learn about addiction was to see somebody who suffered from addiction for about 40 years, and that they were a very intelligent person, and I thought that they could be well. And so I did not understand the addiction. I did not understand getting so far and then just like jumping back into the river. So I wanted to know. And so I signed up for a class, and then I got to learn about the brain and how the brain responds to different chemicals. And so that was the beginning of that. In my own life, what I started liking to study and to learn was how to be happy. And I always hear a lot of people say that happiness is a choice. So I was thinking, okay, I choose it, but then it never worked. It didn't happen. And I was wondering, well, how come I'm choosing it, but it's not happening? So then I studied, what I learned was how to raise your level of happiness, how to raise your vibrations. And so, the whole thing is that emotions come and go, and you have bad times, you have suffering. There's no escaping that. You will suffer. But the whole point is to learn how to manage the suffering and to learn your emotions and to learn how to, one is to definitely to sit with those emotions. And it's like sitting with a friend who's suffering. You don't try to run away from, some people do. Some people will run away from others that are suffering, but people who have compassion will sit next to you. And then they will offer their generosity, their kindness. And this is what you do with your own emotions. So, and this is just a daily practice. So what inspires me to be in this field is that people are suffering. They're suffering from addiction. They're suffering from the causes of the addiction. And so I would just hope that they could also get in on this search and try to find out how they can do this for themselves. So that is my self-care. My self-care is, you know, what we do if we're praying for somebody, we're making medicine for them. When we're done, we have to bathe up. We have to wash all of that off. That's because this sickness and these energies, they can get on you. And so that's what I do too. There's ways of washing off you that in a very physical sense, that's what you do. But there's other ways too, is to involve yourself in some, to make sure that you're doing activities for yourself. One thing I like is gardening. I really get a lot of happiness from gardening. I also do my own medicine wheel. Things that are important in my medicine wheel is sleep, is spirituality, it's nutrition, eating salads from my garden. Socializing was really a difficult thing, and being involved was a difficult thing for my personality. But those are the things necessary. You have to learn them to experience a higher level of wellness. So that's my recommend. Thank you for the question.
Yes, thank you for the answer. Wonderful responses. We really appreciate it. And again, for those watching, feel free to leave your questions and comments in the chat, and we'll try and get to them as soon as we can. So yeah, we'll let you to back to the presentation.
Yeah.
Whenever you're comfortable.
I think the next thing we kind of wanted to talk about, yeah, as Native Americans in this community, I noticed that there already is there's a lot of stigma surrounding Native Americans. It seems like whenever we see something in the news about Native Americans, it typically is something negative, you know, and so we already live with that in general. And then you throw addiction in the mix and the stigma that comes with that, and the stigmas that we put on ourselves is something that's another barrier, another struggle to recovery. And so I think Robbie had a little story about that.
Yeah, I do. And I agree that we do have enough of that, you know. And I think that the whole boarding school thing, how it stripped away a lot of what we loved and made a generation of our people have shame towards those things. And the one way for healing that, you know, we're aware of here in our facility is to bring back those things into our life. Some of our community members have never had those things in their life. And so we try to bring them back into the culture for, you know, for their healing. And it's really their right to be there also. So with that, you know, I do want to share a story, and then maybe we could have some questions about it. This is a story I was talking with my dad about it this morning to make sure I knew the story and that it was appropriate. He said that yes, this story is appropriate for healing, or it's a story his grandma told him, our grandma Josie, and it's a story about a little bird that, you know, all the birds were flying south for the winter. And so this particular bird had gotten injured and it had a broken wing. And so it was trying to fly, but it could not fly. So it was really worried about how it would survive in the winter. And so it just came along in the forest of a bunch of tan oaks, acorn trees. And it thought, well, I think maybe I can nest up in this tree. And so it asked the tree, it said, do you think I can nest up in your limbs for a bit, because I broke my wing and I can't fly with the rest of them. And the acorn tree just like shaking around on little acorns dangling around. It's like, don't you know, don't you see I'm important, and I'm getting all these acorns prepared, you know. If you're gonna get in my limbs, you might knock some of them out and then I'll have a bald spot. Yeah, no. And so the little bird felt sad, and like, no time to feel sad. He's got to move on. He's got to find a place that he can winter over. And he keeps going along, and he sees some dogwood trees. He's like, oh, that should be a nice place. So he asked the dogwood tree, so my wing is broken and I'm not able to fly with the rest of the birds. And I was wondering if I could nest up in your limbs there and over the winter. And the dogwood was like, don't you know, I have all these beautiful flowers here, you know, and if you're going to be there, you know, you're going to ruffle up my flowers. And, you know, no, I don't think so. So the little bird was really disappointed, because it looked like it would be such a beautiful place. And so he kept moving on, and this is a huge tree. It's a huge tree, and he asked that tree, even when he started to speak, he just felt like he was shaking because this tree was so huge. He just was shaking, and he says, like, tree, do you think that I could winter over in your limbs, because my wing is broken and I need help? And so the tree said, yes. And he bent over with the limb and scooped the bird right up and took care of that bird. And so that tree is a redwood tree. And so this tree in our culture has a lot of important meaning to us. So this tree is in the tree when we build a house with it, so a redwood house, we put such things that are human-like, like organs. It has a heart and lungs. And the same with the canoe is, if you notice the way that a canoe is built, it's built out of a redwood, and it will have, lungs and kidney and heart. And so the idea is that this tree has a human quality about it, and that the human quality that it was showing to this bird was compassion, and it was responsibility, that we're each other responsibility to take care of each other. And so in this context that we're talking about stigma, you know, it was one of the first things that came in my mind in talking about it, is that, again, like, this is the kind of values that we have as the greater community. We have, it's important for us to realize that we could be acting out like these other trees, that maybe what our job is much more important. So that's what happened with the oak, is that I got stuck with this job now of feeding the people. So that's all it does, is it makes acorns, it drops, and then it feeds the people. And the dogwood, the flowers only last a small amount of time, and then it drops off. And so along with that is that the creator also said that this will affect your relatives, your family, your relatives. So all of the trees like that are losing their leaves and whatnot. And the ones that we use in ceremony are the ones that are like the evergreen, or like the redwood.
Beautiful story. Thank you so much. I really appreciate using the context of stories, because that's something that's so natural to, the people around here. Like that's how we learn our lessons and our morals, which how many people do. But it's so great, I think, to teach people of all ages, recognizing that stigma and that healing. So I really appreciate that.
Yeah. Mm-hmm.
We did have a few more questions from people in the Facebook chat. One of them being, how important is self-care?
Well, I mean, for us as human beings in general, I mean, we go through life and we're going to have ups and downs, and if we don't have that one thing that's our go-to, to be able to balance ourselves out, we can get stuck in those downs, so we have to have something that brings us happiness, that relaxes us, that calms us. And if we don't have that, it's so easy just to get stuck in negativity. And so it's 100% important. And just making sure that we make time for that. Even when things aren't going bad, we have to do those things and make sure that we're reminding ourselves that it's there. So when things get tough and it seems like everything's just that way, we can remember, oh, wait a minute, I enjoy gardening, or I enjoy, just going for a walk on a beach, or sitting and talking with somebody who gives you good advice. It's important to remind ourselves that and make it a habit. Talking about addiction, everything's about habit, so making these new habits, it's so important in recovery, but just as human beings in general, I think. So.
This self-care, for some reason, this image popped up in my mind of, I used to go to school at Haskell, and I remember looking out the window, and because I heard this weird noise, like tick, 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 tick noise, and I looked out the window and I saw this guy riding a bicycle, and his spokes were cut. They were broken because you could see the spokes. And I was wondering, how is the wheels even turning on that bike, and the most of his spokes are cut or broken. And so I look at self-care like that. Self-care is like a wheel where the spokes are what they call is true. So that means that they're tightened to the same degree. So that means that your wheel will turn smooth. Now, if one of those becomes loose, you're still going to roll. And like I saw on the guy's bicycle, if many of them are loose, your wheel is still going to turn. But what's happening is, as each one becomes a little loose, it's actually putting stress on the other ones. And so that's why the other ones are going out of balance too. So self-care needs to happen before that happens. So it's always, I think it's a daily practice. Self-care is a daily practice. And so that we're not all perfect. We're not all going to have it's not all going to be true. One is going to be loose, but you catch that one before it puts stress on the others. If a couple of them are out, pay attention to those, because at some point that wheel is not going to turn. You're going to crash. You're really going to have to search for your balance back then. Some of those things that I do is different. I'll focus on different areas of my life. I just focused this last couple of weeks on a fast. So I decided to do a fast from caffeine and sugar. And so what happened in that is I didn't get as agitated. I could feel that chemistry in my body shifting. And I was able to sleep a lot better at night instead of waking up in the middle of the night. And also I didn't have to go to use the restroom all the time. So just things like that, you can keep yourself in check.
Wonderful, thank you. Well, we do want to respect, your time and your space. So we just wanted to ask if there's any, if you have any more to your presentation you'd like to expand on.
Just basically, we're kind of talking about stigma and how people stuck in addiction can face stigma as well. Us as counselors and providers of treatment, I know that there's a stigma surrounding us, and what we do and what it means to actually go see a counselor. And, it's just really important for us today for people to see who we are. I know that we're just people here that care about people's well-being, and we enjoy being part of people's journeys of recovery. And it's just really important. Me and Robbie talked about doing some sharing of the screens and some PowerPoints, and we decided against it because we really wanted people just to see that, we're just human beings making it through this world too. And if we have any offer to help, that we really want to be here for everybody.
Yeah. And also to hang in there, that, we hope the situation with the COVID is a passing thing, but while it's here, to stay connected. And these are the ways that we can stay connected. And everybody that I've seen coming in through, these doors has a device. So that means we can still have groups, we can still have individuals, and we can still have activities as long as we're practicing the social distancing. So I would encourage, if people have ideas for activities, we'll certainly consider that and see if our safety department can approve something like that.
And I wanted to add real quick, I noticed you had a lot of telephone numbers and warm lines and different things at the beginning. I just wanted to add that, our behavioral health realizes that this is a very stressful time for people. Definitely anxiety comes up, and feelings of, routine can sometimes create some levels of depression, or different feelings come up. And so I know it's out there a little bit, but we do have a warm line that goes straight to a behavioral health counselor. And so if somebody is just having a particularly rough day and they just want somebody to talk to and they don't have anybody else to talk to, maybe just getting some tips on how to bring that anxiety down in the moment, we do have a warm line that's meant for that. It's not a hotline. We will direct you if you are actively suicidal or anything else like that to a hotline. But we do have a warm line where, if you're just feeling overwhelmed today and it's just, I would like to talk to somebody. And so it bypasses right past the front office. There's always somebody manning it from 8 to 5, Monday through Friday in our offices. And there's somebody that will pick it up, and you'll be in direct contact with the counselor. You don't even have to say who you are or any of that. I don't know if you guys want the number or if maybe you can put it up for us, but it is 707-825-4080. Yeah. So I just wanted to make sure everybody knew that's available out there too.
Awesome. Thank you for that. Yeah, so we have that number in the chat on the Zoom, and we'll also put it into the Facebook Live for everyone, and in the description of the video when it goes up on our YouTube for those looking for that resource. Wonderful. Well, thank you both. Do you have anything else you'd like to add before we get into some more questions?
Well, I wanted to add, too, is that we also have, we're also educating about addiction and in any particular drug or, whatever you wanted to know, alcoholism. I know that was my curiosity. That's why I started studying it, was how does this affect my brain? So even if you're just curious about that, especially young people. I would encourage young people to get as much information as you can about this, because at some point, somebody is probably going to offer you that.
Wonderful, thank you. Well, before we end today, do you want to answer a few more questions? We had a couple in the chat. Do you believe in the 12 steps of wellbriety Redwood help us natives? Do you believe the 12 steps helps us natives? I see.
I definitely believe it does. You know, there's a lot of similarities to NA and AA. But what I like about it is it talks a lot about cycles. You know, as Native people, we have all these cycles of you know, stages of life, seasons, all these different things. And so it kind of puts it in a perspective that personally as a Native, I can relate to a little more. I've been doing it for quite a while. And currently Robbie is doing our Red Road group. And I just have to say she is amazing at it. And she's mastered Zoom. So she does a great job of facilitating it. And one of the things we would like to do is we're talking about just offering support groups at a time like this, to where, you know, maybe we will run a Red Road group that's just kind of an open forum like this, where you don't have to come in and be assessed and create a treatment plan. We look forward to creating a Red Road group for people to drop in and be able to listen. I know I will sign up for it if Robbie's doing it, so I would love to join that group.
Yeah, I think that it is useful for anybody, and the reason is because in studying a lot of different cultures and a lot of different philosophies, is that basically the core values are the same in a lot of ancient cultures. And so in my own experience too, I went to AA meetings when I suffered from anxiety. And I've even gone to like OA, which is Overeaters Anonymous. And one thing that impressed me was that there is some sort of an underlying power in these, always within these circles. And it's also true with the Red Road. It also uses the 12 steps. So there's something in those 12 steps that I think are necessary for wellness. And I think that they're just translated differently for each setting. So yeah, I think they are.
Wonderful. So we have another question. Do you have openings, or is there a wait list to start the program? And can I get information on the program, or like, I'm sure some resources to find information?
Well, that, like I said, is one of our main goals for coming on here is it seems like with all the shelter in place, what's open, what's not open, who's providing what, it can get a little confusing, and a lot of times be a deterrent to taking that step. And so our goal is to let you guys know that we do have openings. If you are a member of the clinic and you get signed up, and you're welcome to call our office here in Humboldt County is 825-5060. And so we do have openings. So that is our number for down here in Humboldt County. In Del Norte, our main office is out of Elk Valley, but they can sign you up if you're going to do counseling in Smith River or Klamath. But you would call our Elk Valley office, and their number is 707-464-2919. And we have openings in both of our programs, and we definitely encourage people to stay connected. Like Robbie said, you know, one of the things about COVID right now is, you know, the lack of human contact, and in addiction, that's that's a huge trigger, you know, being off by yourself and maybe falling back to what's familiar. And so definitely encourage you guys to call if you need services or you know somebody, pass those numbers on and let them know that we're here.
Awesome. We do have a few more questions. So what is some of the trauma that causes addiction, if you're willing to expand a little bit on that?
Yeah, I'll go first because then Jeff can follow up. But I really don't think that the trauma itself is creating the addiction, but because this was my favorite part of the study was understanding how addiction is created in the brain. And the deal with that though is that once it does happen in your brain, it's probably hardwired into your brain. And so that addiction pattern is probably going to be there for your life. It's now dealing with the cravings and dealing with the triggers that might lead you back into that. But I think the brain kind of gets the short end of the stick when people talk about addiction, because all it's doing is what it was created to do, which is to ensure your survival. But it doesn't know that you're going to poison it with an overload of chemicals that it already has in the brain. That you're supposed to learn how to generate that chemistry in your body by your actions and not just from taking a substance.
Yeah, I think that's a pretty big question. I think I get what they're asking. Man, traumas, there's such a wide array of traumas, and it could be, for Native communities, definitely generational trauma that gets passed down from boarding schools or relocations. Just the fact that, we were seen less than human beings until recent times, and probably in some people's minds still today, and so there's so many traumas that have accumulated over time, and then you throw in our own personal traumas that we go through while we're growing up, and then unfortunately a lot of Native people, we start doing it to each other, and so there's a huge number of traumas. But I was talking to Robbie about as a certified substance abuse program, a lot of times we have to have enough evidence-based curriculum to maintain that certification. And the thing I love about working here is that as natives, we each and every one of us that are sitting here today, we know we also have resiliency. We know that we come from very strong people. And so I told a group of people one time, my great-great-grandparents, they were not doing DBT or EMDR, all the evidence-based things. We have it built into us. We have all these resiliency factors to combat that trauma. And it's just about creating a space to be able to see that, those traumas are like a window blind sometimes, and we don't see that. We have it inside of us, and it's our job to help you kind of pull back those blinds and really see that how strong we are and how strong of a people we come from, and really look at those in a different way.
Thank you both for that. I know it's a really heavy question to answer, and it can, bring up a lot of feelings. So we encourage those watching, reach out because it is a very heavy topic for everyone. We do have one more question from the Facebook chat, and this is for both presenters. I know you both kind of talked about how COVID has affected the programs and UIHS in general, but how has the transfer to Zoom due to COVID affected the treatment process for you both as counselors and the clients personally?
You want me to go?
Oh, we had to learn how to use the Zoom program, and the Zoom program is limited. There are other programs, I'm sure they're working on them now, but I just went through a 2-day conference and I really liked the app that they were using. So I think that it's just learning how to use this, the technology. And the sad part about that is, you know, in a lot of ways, we kind of already conditioned ourselves to this telehealth, because we're doing a lot of texting, we're doing a lot of social media and things like that. But in counseling, the one-on-one was really important, because it's a live thing and we feel each other's energy. And in that way, we can kind of understand our the community member that we're working with a little bit better. So I feel like that's a missing aspect in telehealth, is that not really able to pick up on their energy as well, or to share yours.
And I think, I mean, just asking for help already is such a huge step for somebody to take. And then they get here, and by the way, you also have to download an app and check your emails, and it's you know, sometimes it's like any little thing in addiction. You know, I've already overcome this hurdle to ask for help. It can be really overwhelming. And so, like I said earlier, we do have people that will sit with people and make sure that, you know, their Zoom app is downloaded, that they know how to do it. You know, we can even do a test run. I know our front office person, I personally watched her help somebody download the app and then send them a mock link and have them open it. And so, you know, we're trying to do our best to help people get over that hurdle, but it's definitely another hurdle, and but it's not one that we can't overcome, you know. So I just hope people have a little more confidence in themselves and look to us, you know, like that little bird Robbie shared, you know, flying around asking for help with the broken wing. You know, Zoom's just another one of those things. If you don't know how to do it, don't let it overwhelm you. Just, you know, say, hey, I need a little help, and we definitely can provide that.
Wonderful, thank you. Before we get off today, I do want to ask a few questions. What is your hope for, you know, the future and future generations through all of this work?
One of my hopes is that, so one thing that we provide here in counseling is that we listen. We listen to people's pain, people's story, and we validate those things. And this is also in behavior and mental health as well. And it's sad that a lot of the community members, they don't have people in their relationships are not offering them this, and their families are not offering them this, or the community is not offering them this. So one of my my wishes is that that we learn how to be not necessarily counselors to people, but that we really study and learn and practice compassionate listening and loving speech, so that because we're dealing with a lot of pain. And so until we're, you know, we have a huge healing across the board, and this isn't just with the community members in addiction, this is across the board. So we're all affected with this historical trauma. So if we're like that, then we should offer each other that compassion and kindness, not to be, you know, afraid of people's emotions. That's my wish.
Yeah, I'm kind of along the same lines of what Robbie's saying. You know, my hopes are just that that we learn to not just look at somebody in addiction and judge them for that. There's nobody in this world that was, you know, 5 years old saying, I want to grow up to be an addict. You know, I want to grow up and live on the streets. I want to spend my life in prison. Nobody does that. Something happened up that river, and it's up to all of us to be there and support those people that are trying to make that journey, not put up barriers or make them feel ashamed, or praise them. I've seen a lot of youth activity going on where very young people are coming out already and talking about their struggles and their recovery, and it really amazes me, and I think when it's these young people, we're a little more open to say, wow, good job, wow, that's amazing, but we're all that young person at one point. And so just hopefully we can look at everybody with that same compassion and just really try to hear people's story and try to have some understanding and show them that we care, and try to learn how to be the best support we can for each and every one of them.
Wonderful. Thank you both. Well, I just want to say thank you for your presentation today. It was very beautiful and heavy and, meaningful to myself, and I'm sure many Native people watching especially, but to everyone. And I just want to, ask if there's any last advice or words you would like to give to those watching from yourselves.
One thing I wanted to tell you is that you're an amazing host. And thank you. But I guess I would like to say to the community is to come down and get an appointment or call and connect and find ways that you can help, and that we're always looking for activities to do for wellness. And so in this model of wellness, the social part of it means community. And I like that we're natives because this has always been our part of our wellness. And that if we could just expand that into these programs and become involved in those. It's funny that I'm saying this now because most of my family are involved in it. I think I'm probably the last one to become involved in it, but it really does help. So that's what I would like to say. Don't be afraid to reach out and become involved.
Yeah, I just want to tell everybody not to give up on yourselves. I know it's somebody close to me kept saying it's too hard, and it's really not. When you have support and we're trying to build this community that we're building, it's different. It could be scary, it could be a little difficult, but give yourself some credit and just dig deep and find that strength and know that people are here. We're here to help you. I always like to tell clients, if you want to crawl, as long as you're moving, I don't have a problem getting down on my hands and knees and crawling right next to you. But eventually, your hands and your knees get a little sore and you're going to want to get up and walk. And then I remind them that I'm not getting any younger, so I hope they get up and walk sooner than later when they're crawling. As long as you're moving forward, just keep doing it and don't give up on yourselves. It's as strange as it sounds, people living out in addiction have been through things that a lot of us will never have to go through. So the strength that they have in themselves, their creativity, their resilience is actually something that a lot of people will never even know, but they got to apply it into the right direction and still remember how strong they are. So I would just say, don't give up,
Wonderful. Well, thank you both so much. I really appreciate you both being on here, and you both are amazing, and I admire you both so much for the work that you're doing. It's very meaningful, seeing Indigenous people do this work for Indigenous people and people in general. It's really heavy and very appreciated. And yeah, I just want to say thank you both, and we appreciated having you today.
Thank you.
Thank you.
Wonderful. Well, again, I just want to thank our presenters for being here today. a beautiful, wonderful presentation of the important work that they're doing for our communities up here in Northern Cali. And I just want to say thank you to all of those who watched and who stayed tuned for the whole thing, and hearing about the work, and those who asked questions. Amazing. I'm glad everyone is getting the information that they're looking for. Before we get off today, of course, I just want to remind everyone that we are the Wellness and Recovery series, and we are on week 4. So today we did have the presentation this morning with Dr. Katie Castle, who is also from UIHS and did an amazing presentation more on the medical side of it, and had some great information. And during this presentation currently, they recommended, go watch that if you can. It has some great information that really ties into this presentation as well. Please remember to register with us through Eventbrite. We are on almost the last week, and so we still encourage you to register so you can get your t-shirts and get your information for the upcoming events for the end of the Wellness and Recovery series. We will still be having live presentations Tuesday, Wednesday, and Thursday until July 30th. This will include speakers, panels, series, videos, activities, and social media campaigns throughout the month. And this series will be going out via Zoom and Facebook Live, so stay up to date and informed by registering on our Eventbrite page. And you can also follow us on our Facebook page. We do have the Wellness Art Challenge happening until July 27th. So the deadline's July 27th. You can still get those entries in. Make sure to download the PDF of the Wellness Art Challenge on the Wellness and Recovery Facebook page. Or if you register on our Eventbrite, you can also download it there. So what you're gonna do is draw in the middle what your wellness activity is, and what are some things you do in order to keep your mind, body, and spirit healthy. We're not judging by artistic talent. Any entry is valid, and it can be anything. The sky's the limit. A drawing, a poem, a photo, a video. If you want to go there, you can do anything. So make sure you enter in the Wellness Art Challenge and upload it or scan it to social media using the hashtags HealthyDelNort and hashtag Wellness Challenge, or you can just email it to us at rxsafedelnort@gmail.com. Remember to include the artist's name and age group. The age groups are 0 to 5, 5 to 9, 10 to 14, 14 to 24, and 24 and up is adults. We will be sharing the art, and again, each age category is eligible for an entry into the raffle. We're gonna have some awesome prizes, wellness prizes. And again, we're not judging on what you're drawing. Every drawing is eligible, or every creation is eligible. So make sure to join the Wellness Art Challenge. Again, this is our final, it's showing our 3 weeks, but we have 2 weeks left. So this morning, again, we had the Dr. Katie Castle presentation, and this afternoon we had Robbie Lara and Jeff Guido from the UIHS as well. And tomorrow's Wellness Wednesday, so make sure to tune in to that. We still have another Narcan training coming up on Thursday. And in the afternoon, it's still a little open, but I think we might be doing a movie and discussion. And then next week is at the bottom. We will be wrapping up at the end of next week. I know it's sad, it went by quick, but we enjoyed having you all for this past month. I also want to remind everyone, if you didn't get to make every presentation or event, you can check out each presentation on our YouTube page. So if you go to our YouTube page at RX Safe Del Norte, we have all of the presentations and events except for the morning wellness Wednesdays, because that is not through us, but make sure to check those out if you want to watch those again. And again, just thank you so much to our presenters today. You did beautiful. Thank you to all of those who commented and tuned in today. We really appreciate your engaging with us today, and we really appreciate your participation. It means a lot, and we hope that you enjoyed yourself. And always remember to fill out our evaluation form. So we always have an evaluation form at the end of every presentation. It does have a few questions. Try and answer them the best you can. And each completed evaluation is an entry into the wellness raffle, which will be announced at the end of the series on the 30th. So make sure you fill out your evaluation form, because then you get entered in the raffle. And remember to check out our Facebook page for the event at the Wellness and Recovery Series. For more information about RX Safe Del Norte, you can check out our website at rxsafedelnorte.org and our Facebook at RX Safe Del Norte. And again, if you want to review the past presentations and workshops, you can check out our YouTube at our RX Safe Del Norte to see the stuff that we've been doing in the past, if you couldn't make it or you want to watch it again. So again, thank you everyone for joining us today. We appreciated having you, and have a good afternoon.